Good evening and happy Tuesday, everyone. I'm David Diehl, two-time Super Bowl champion of the New York Giants, and welcome to Championing Men's Health, a proactive approach to keeping you healthy, presented by RWJBarnabas Health. The information being presented this evening is general advice. You may want to consult with your personal physician about your particular situation. With that being said, we have compiled a panel of experts to help you and your family live safely within our new normal. Let me introduce our panel. Starting off, Dr. Sonu Mody, the family medicine physician at Jersey City Medical Center. Dr. David Franzoni, urologist, Clara Maass Medical Center and Newark Beth Israel Medical Center. Dr. Gautam, Visveswaran, interventional cardiologist, Newark and Beth Israel Medical Center. Dr. John Feldman, orthopedist, St. Barnabas Medical Center and Jersey City Medical Center. And last but not least, Dr. Lindsey Whalen, registered dietitian and RWJ University Hospital, Rahway. So let's get this started. I'm very excited to hold this. And when it comes to men's health, I know that it's one of those stigmas, especially me being a Croatian. When I talk to my uncles, it's one of those things that they really don't want to talk about. And it's one of those things that not a lot of men want to speak up and talk about getting help. So having a panel like this of unbelievable doctors to get this information out to make us a better society is something that we greatly appreciate. So thank you very much, doctors, for taking the time tonight. We're going to start the panel tonight with Dr. Sonu Mody. And starting off, doctor, over the past year, many men have not completed their necessary preventive health measures. With that said, what are some of the steps that someone should take to take care of their health and prevent disease?
So first and foremost, they should go to their primary care provider. If they don't have a primary care provider, they should call up their insurance to see which providers are covered within their insurance. They should get a comprehensive physical exam by their PCP to determine which age-appropriate preventive screenings they qualify for. People often think, well, I'm healthy, why do I have to get an annual physical every year? It's not only about getting the physical done, but it's important to establish that relationship with your PCP in the case that you ever, do get sick. It's important for your primary care provider to know about your medical history, maybe even have some baseline lab work. So to have that pre-established relationship is really important.
And what about those people right now, Doc, that are on the call that may not have a doctor? What's the best way for them to find one?
So, first they should call their insurance or their health plan to determine which doctors are in network. Once they do have a list of in-network doctors, they can narrow down, according to their preferences, including, how close they are to where they live, etc.
And with that said, what vaccinations and screenings should men get that are over 50 and should they receive?
So quite a loaded question, but I'm going to go through some of the more common screenings and vaccinations that men over 50 years of age should receive. A lot of these recommendations are not exclusive to men, but they include like males in the age group. So all these guidelines that I'm going to talk about are from the U.S. Preventive Task Forces. So I'm going to start with abdominal aortic aneurysm screening. So males who are age 65 to 75 who have ever smoked should get a one-time screening abdominal ultrasound to screen for abdominal aortic aneurysms. Also, there is lung cancer screening. So this is both men and female, but age 15 to 80 who have a smoking history of 20 pack years and currently smoke or have quit within the past 15 years should receive an annual lung screening with a low dose CT. Also, I'm sure the other doctors will talk about this, but prostate cancer screening. So men who are age 55 to 69 and are at average risk for prostate cancer should have a discussion about the benefits and the harms about being screened with for prostate cancer with the PSA. And then in adults age 50 to 59, there's a recommendation to start low dose aspirin for the primary prevention of colorectal cancer and also cardiovascular disease with patients who have either a 10% or greater 10-year cardiovascular risk. Obviously, this is a discussion you need to have with your doctor, especially, weighing the risks and the benefits. These patients that are started on an aspirin shouldn't be at increased risk for bleeding, should know that, they have to continue or should continue the low dose aspirin for at least 10 years. And these patients should also have about at least a 10-year life expectancy. The other recommendation I'm going to talk about is for colorectal cancer. So there's a lot of, data coming out now, but the grade A recommendation still holds that screening for colorectal cancer should start at age 50 and extend to 75. The grade B recommendation is now saying that in all adults, age 45 to 49 should also have colorectal screening. And that's because nearly 94% of new cases are actually occurring in adults 45 and above. And then another recommendation, so all adults age 40 to 70 of age who are overweight or obese should receive screening for abnormal glucose for diabetes as part of a cardiovascular risk assessment. PCPs are expected to provide proper counseling to promote a healthy diet and physical activity. And then the last screening would be for patients who are adults, so 40 to 75, that have no history of cardiovascular disease, but have a cardiovascular risk factor, including hypertension, hyperlipidemia, they're smokers, and they have a calculated 10-year risk of a cardiovascular event of at least 10% or greater. They should receive a low to moderate dose statin for the prevention of cardiovascular events in the future. The cardiovascular risk that I, talk about, that's something, you obviously should discuss with your primary care provider, and they should go through that calculation with you. And then I'll talk about some common vaccinations. Like I said, these vaccinations aren't exclusive to men, but include men in the group. So as part of the routine vaccination schedule, all adults should receive one dose of the Tdap vaccine, then the TD booster every 10 years. And then there's the zoster vaccine. So patients age 50 or older should receive a 2-dose series of Shingrix 2 to 6 months apart, regardless of their previous herpes zoster history or history of getting the live vaccine, the Zostavax. And then there's the pneumococcal vaccine. So patients who are aged 19 to 65 with chronic medical conditions, including chronic heart disease, liver disease, lung disease, have diabetes, or are alcoholics or smokers, they should receive 1 dose of the Pneumovax vaccine. If you're 65 or older, you should receive 1 dose as well. All adults 65 or older should receive 1 dose of Pneumovax. And then you should have a discussion with your primary care provider if you should get the Prevnar vaccine as well. And then patients with chronic liver disease. So that's fatty liver, cirrhosis, alcoholic liver disease, autoimmune hepatitis should also receive either a 2 or 3 dose series of the hepatitis B vaccine, as well as the hepatitis A vaccine.
Awesome. Thank you so much, Dr. Mody. I greatly appreciate you taking the time. And on to our next doctor. I would like to bring Dr. Franzoni on, please, the urologist of Clara Maass Medical Center and Newark Beth Israel Medical Center.
Thank you. So a few of the more common conditions that we see as urologists include enlargement of the prostate, prostate cancer, erectile dysfunction. So just quickly, BPH, otherwise known as enlarged prostate, is something that all men will experience as we age. Not all men will have symptoms of BPH, but some of the more common symptoms may include having to get up at night to urinate frequently, during the day, having more frequent trips to the bathroom, maybe having more difficulty holding your urine, having to rush to the bathroom frequently. Men may experience decreased, force of stream. They find it difficult to urinate. So if a man's experiencing some of those symptoms, one of the causes could be BPH. But it's important to talk to your doctor, your primary care doctor, or your urologist, because sometimes some of those symptoms may be other problems, including diabetes and kidney disease. And so it's not always just BPH. So it's kind of our job to figure out what it is. But it's a benign condition that's treatable. And if men have those symptoms that are interfering with their lifestyle, there is treatment.
Dr. Franzoni, with that said, I have to wake up in the middle of the night and use the restroom a lot. I drink a lot of water throughout the day. Is that normal? Should I be concerned about that, or is that okay?
So as men age, you can expect to get up maybe once or twice a night. It kind of comes with the territory. If it's really disruptive or it's associated with other symptoms throughout the day that are just kind of interfering with your lifestyle, it may be worth, talking to a physician. If it's excessive, or if it's associated with other symptoms, pain, burning, bleeding, it may be something altogether different and probably should be checked out. But, once or twice a night is probably par for the course. And that's okay, especially if you find yourself drinking a lot of fluids.
And how often or regularly should a man go for testicular cancer and get that screening for it?
So as testicular cancer is not something that would necessarily need to be screened for. It's it's not a frequently diagnosed cancer, and even cancers that are diagnosed at late stages are very curable. So as far as screening protocols for testicular cancer, there isn't really any recommendation. It's not a bad idea that when, every now and again, when you're in the shower, to do a self-exam. And if you have any concerns about something that's, you're feeling abnormal, bring it to the attention of your doctor. But routine screening for testicular cancers is not generally recommended.
And my last question for you, Dr. Franzoni, is obviously when it comes to being a man, something that's brought up and something that men have more common is prostate cancer. What are some of the steps that somebody can take to decrease that risk of getting prostate cancer?
Sure. So while there really isn't anything that's been shown to outright prevent prostate cancer, there are some steps you can take to help reduce your risk of prostate cancer. And like a lot of other conditions that may be able to be reduced by certain activity and diet, it's very similar. It's making sure you're maintaining a healthy weight, getting the right amount of exercise, and maintaining a healthy diet, which generally is going to include more of a plant-based diet, fruits and vegetables, whole grains, trying to reduce your amounts of processed foods, the sweet, sugary drinks, red meat, limiting that. There are certain things, even lycopene, which is found in tomatoes, soy, the soy milk, the soybeans, those things can help. And so there are some diet recommendations that you can follow.
Perfect. Thank you very much, Dr. Franzoni, and greatly appreciate your time as well and your useful information. Next, we're going to bring on Dr. Gautam Visveswaran, the Interventional Cardiologist, Newark Beth Israel Medical Center.
Thank you for having me today.
There we go, Doc. Now we got you. Okay, doctor, when it comes to covering what is heart disease and what are some of the risk factors and what are the early signs that somebody can see that are part of being heart disease?
Simply put, the heart is the motor of the body. The symptoms can vary, but when we're talking to men, the most common symptoms of heart disease or coronary artery disease or cardiovascular disease is either chest discomfort that is in the chest, feeling unusually short of breath. If you were able to do something 2 months ago and now you're trying to do it and you feel really out of breath, you're really fatigued, there could be a problem. Not all heart attacks are chest pain. Shortness of breath or a feeling of indigestion could be the symptoms of a heart attack in a man, as in a woman.
And with that said, when do you think is the time that somebody should call 911 when they start to see what symptoms specifically?
If you feel chest discomfort that does not recede in a couple minutes with resting, if you feel shortness of breath that does not stop when you stop for a couple minutes, and there is a certain sense of progressive symptoms that last more than a couple minutes, or you have this little anxiety that something is wrong, my advice, don't ignore it. Call 911.
And to go along with that, and obviously with heart disease, it definitely plays into the factor of what your blood pressure is. What do you think the ideal blood pressure is for an individual, doctor?
I say as low as possible. Why do I say that? The lower, the better. Blood pressure is required to keep your arteries and your organs perfused, but it's the same thing. It's the pressure in the pipes that sometimes can wear down the arteries and then can cause disease. There's a lot of conflicting information on this, David. The societies have been going back and forth with every committee report they've put in. The most important thing is you need to have a blood pressure under 120/80. And we've shown in research trials, one of which came out recently in The Lancet, which is a very prestigious publication, that shows that a 5 mm reduction in your systolic blood pressure, or the top number of your blood pressure, irrespective of whether you have heart disease or cardiovascular disease, decreases your risk of a stroke and a heart failure by 13%.
Wow.
And the risk of heart attacks or ischemic heart disease by 9.5 to 10%. So to me, the number one cause of excessive cardiovascular disease that we can stop today is blood pressure control and managing it. And like Dr. Mody pointed out, visiting your primary care physician once in 6 months or having a conversation with them and having a general check is absolutely a fantastic idea.
Dr. Visveswaran, we heard from both Dr. Franzoni and Dr. Mody talking about body weight, talking about obesity, and especially for men, the belly fat around the midsection. Talk about the impact that that has on heart disease.
Belly fat is basically akin to having a chronic fever. That's the way I put it. Belly fat is an inflammatory agent. It is a form of chronic inflammation. It prevents the action of insulin in your body, which is required for you to absorb the food you may eat and digest. So having belly fat is actually going to increase the risk for you to develop early diabetes. It's going to increase the risk of cardiovascular disease because it is an inflammatory substrate. You have to make a conscious effort to exercise. And the recommendation is try to get at least 30 minutes 3 times a week and try to keep a stable weight. And if you can achieve it, try to cut back on your belly fat.
And with exercise, obviously, we'll go to Dr. Whelan later in the program, but it also entails with diet. Name some of the ways that men can fight against heart disease.
The only diet, David, and this could be a little controversial by saying it, that has been ever shown to reverse cardiovascular disease or, reverse the clock is, like Dr. Franzoni said, a plant-based whole grain diet. There have been numerous studies that show that increased consumption of processed meats, processed foods, actually increases your risk of cancer and cardiovascular disease. So my recommendation to my patients is you don't need to go to the very extreme, but you really need to make sure that you're having a healthy diet where you include a lot of fruits, vegetables, and whole grains and not make it primarily a meat-based diet. So you can actually stop the progression of disease and or reverse it if possible.
Thank you very much, Dr. Visveswaran, and thank you very much for your time. And from somebody who's coming who lost family members due to heart disease, it's grateful information to receive.
Thank you. Thank you for having us.
Thank you. Next on that we're going to have on the panel is Dr. John Feldman, Orthopedist, St. Barnabas Medical Center and Jersey City Medical Center.
Thanks, Dave, and thanks for having me. I'm going to take a brief moment to talk about issues with the rotator cuff. And the reason I'm going to talk about that is because it's by far the most common cause of shoulder pain that I see in men in my office over the age of 45. And so briefly, what is the rotator cuff? Essentially, the rotator cuff is a group of tendons that attach to the ball and socket joint in the shoulder. And they serve sort of two functions. One is to keep the ball compressed in the socket, and the second function is to help raise the arm. It's the secondary raiser of the arm, the main raiser being your deltoid muscle. And why does it turn into a problem? Is because the rotator cuff lives between the ball and the shoulder blade. So over time, it can get compressed between those two structures, and just through attrition, it can cause inflammation and sometimes tearing. And also, a second way it can get injured or tear is just through a fall or an injury. And so the most common way I see it presented in my office is just shoulder pain over the side of the arm, sometimes radiating down to the elbow, but never past the elbow. If you have pain radiating past the elbow, most likely it's caused by something like a nerve compression in the neck. And patients will complain of pain with any kind of activity, raising it up. Pain at nighttime, sleeping out at nighttime will cause dysfunction. Usually the pain is insidious, meaning it comes without any previous accident, but sometimes someone will have, like I said previously, an accident where they will have fallen on it. And so when I see this in the office, the first thing we always try to do, well, first we get an x-ray just to make sure we don't have a broken bone or something of that nature and no arthritis. And usually an x-ray with someone who has a rotator cuff problem is normal. The next step is always getting somebody in therapy and getting them on an anti-inflammatory. Usually the vast majority of time when someone comes in with a problem like this, just through 6 weeks of physical therapy and some anti-inflammatory, the problem can go away. If it doesn't go away after that time frame, what we'll do is we'll get an MRI to look for a tear. And then if the MRI shows a tear, the next question is, well, what do you do about that? Typically, the problem if there is a tear is that it won't heal on its own. So if someone has a tear, has had an extended amount of conservative treatment, meaning physical therapy and anti-inflammatory, and they continue to have pain or dysfunction, the treatment for a rotator cuff tear is a rotator cuff repair. And the way we do that most of the time these days is through an arthroscopy, where it's a same-day surgery. The patient goes home the same day. And then it's a good lengthy recovery. Usually I tell patients it takes about 3 or 4 months for it to get back to normal, and then they can see improvements up to 9 months to a year. But the good news is typically we don't get to that point, and most people who have this issue can get by through conservative treatment before we have to go through the surgical route.
That's great stuff to hear, Dr. Feldman. And I know that this is a question that I've gotten a million times. Well, you're the former athlete. I'm injured. Should I put heat or ice on it? Talk about that right there, and what should somebody know in order to put heat or ice on that current injury?
Yeah, so if someone has an injury, the answer to that question is ice. And the reason is because when you have an acute injury, your body responds through an inflammatory process where there's swelling and warmth. And what ice does is it tamps down that inflammatory response to abate that swelling and help decrease the warmth and the inflammatory response to help with the pain. Heat is usually good for things like if there's a muscle spasm. So oftentimes someone I'll see in the office has a low back pain and concomitant muscle spasms in their low back, and heat pad is usually good for that. Or if someone has stiffness in the joint and you're going to therapy to work out that stiffness, heating before working out that stiffness is the right way to go. But ice in the acute injury setting.
That sounds perfect. And then also, doctor, I know that you're talking about, well, if it's a rotator cuff, but let's say you're talking to your typical weekend warrior that likes to go out, do their workouts, do their physical activity. What is the major impact, or what should I say is, what is the major point of the cause of some of the shoulder pain that some of those weekend warriors have?
Yeah, I think to some degree it's a little bit of overdoing it. You know, a lot of issue with the weekend warrior is they might go from 0 to 100 without sort of conditioning their body to be able to handle that 100 miles per hour. So first thing is ease into these workouts. You don't have to, lift twice your body weight. Be responsible with the amount of weight you're lifting and the amount you're doing, and listen to your body. So if you feel something going on and feel a twinge in the shoulder, then back off a little bit and let it sort of recover.
And my last one for you is talking about the knee. Everybody has something that bothers them, and a lot of times it's somebody talking about their knee. What is the main causes of knee problems? And also, we know that with science and technology, everything's evolving and there's always something new. Are there any new approaches when it comes to surgery to knees?
Yeah, so when we think about pain in the knee, a lot of it is we have to think about how old is the patient we're talking about. So if we're talking about somebody who's above the age of 45, probably the most common cause of pain in the knee is arthritis related. And so if you think about your knee joint, it's a hinge joint. We have cartilage on the ends of the bones. And what arthritis is when that cartilage kind of starts to wear down, kind of like rubber on a tire. And when that happens, it causes pain and inflammation. And a lot of times what we do is try to treat the symptoms of that pain and inflammation through things like anti-inflammatory, sometimes steroid injections, gel injections, things of that nature. When those don't work, usually a knee replacement is the option. And there's been some advancements in knee replacement technology over the past decade or so. It's the same basic procedure we've been doing for 40 years plus, but over the past decade, there's been some robotic technology that's evolved, that's helping us make more precise cuts, and in so doing, hopefully giving somebody a more precise functioning knee that hopefully will function better and last longer.
Awesome. Thank you very much, Doc, and thank you very much for this information, because I may be somebody down the road that may need to contact you.
Thanks, Dave.
And last but not least, to end the night, Dr. Lindsey Whalen. This is the registered dietitian at RWJ University Hospital in Rahway.
Hi, thank you for having me. And so today I'm going to talk a little bit about your diet and weight. So consuming a nutritious diet and maintaining a healthy weight are some of the best ways to help reduce your risk of developing certain health conditions. Some of the most common health-related issues in men are heart disease, diabetes, obesity, and even some cancers like colon, prostate, stomach, or mouth cancers. And while it may seem like a lot of these diseases are very different from one another, they can all be managed through nutrition in very similar ways. So you want to consume a diet rich in fruits and vegetables, whole grains like brown rice, quinoa, and oats. You want to have lean proteins like chicken, fish, turkey, or eggs, healthy fats like fish, avocados, nuts and seeds, and low-fat dairy products, because they will help to reduce your risk of developing diseases and maintain a healthy weight. But it's also really important that you limit the saturated fats in your diet, the red and processed meats like bacon, hot dogs, and sausages, limit salt and your refined grains, added sugars, and also limit your alcohol intake so that you can further help to reduce these risks for any of these health conditions and help to manage your weight and diet. But along with nutrition comes the physical activity aspect of it. So physical activity plays a big role in reducing your chances at developing any of these diseases or illnesses. Engaging in physical activity for about 150 minutes a week is what is recommended, and that can be broken up into just 5 30-minute sessions per week. So Monday through Friday, maybe you get 30 minutes in and you hit that mark. And this will help you to fight heart disease, prevent insulin resistance so that you can prevent diabetes or help to better manage it, reduce your risk for many cancers, and also help to prevent obesity.
Dr. Whalen, you know, when I talk to people or when people discuss their weight with me and they're having struggles with it, a lot of it comes to emotional eating. What are some of the strategies that they can use to, you know, combat that emotional eating and turn a negative into a positive?
Yeah, so it's really important that they identify what the triggers are for them. So this could be boredom, or maybe they got in a fight with someone. Is it a stressful situation that they have going on in their environment? Is there anxiety, worry, or is it even a happy time? Is there a celebration going on and there's a lot of food around? So it doesn't always have to be something negative, right? That's bringing in a lot of food, right? But it's really important to pinpoint that. And one way to do it is to write down what you're eating, but not just what you're eating, but what time you're eating it at. What were you doing? What were you feeling in that moment, so that you can get the whole picture of what is causing you to turn to this specific food, and how did it make you feel before you ate it and after it. And work on rewarding yourself with something other than food. So maybe go to an event, maybe go to a football game, maybe go have a spa day, maybe you go to the beach, just something else that doesn't always entail having a lot of food around as a reward. Also eating consistently throughout the day. So try not to restrict yourself throughout the day. It could just lead to overeating at another meal or binging later on throughout the day. Finding other ways to deal with stress. So exercising, reading a book, talking to a friend, maybe listening to music, or even just going to take a shower to, you know, do something else, calm yourself down, can help you combat the emotional eating. Also just having healthy, nutritious foods available to you in your house and making those more visible to you. So making sure that those fruits, vegetables, nuts and seeds, put them at the front of your pantry, make those ones visible to you when you walk into your kitchen, so that that is the first thing you go towards. And just taking the time to think before you actually grab a certain food item, or even just walk into your kitchen. Think about if you're really hungry, if you really need that food, or if what you're going to eat is going to provide your body with the most benefit.
And to go along with that, you know, some of the conversations I've had with some of my former teammates or some of my friends in regards to eating healthy and in regards to trying them to eat fruit. Well, fruit has sugar too. Can you eat too much fruit, Dr. Whalen?
So fruits have a lot of benefits for our health. I mean, they have a lot of antioxidants, vitamins in them that can help us to maintain a healthy weight. They'll reduce your risk for certain diseases. And also they taste good, so why not have them, right? But like most things, moderation is key. So a lot of too much of one thing and too little of another thing isn't ideal. So what you want to do is strive for moderation and variety in the diet. For some individuals, like for instance, somebody with diabetes, they might have to be more mindful of how many fruits they're having at one sitting, but also what else they're consuming with that, because they need to monitor their carbohydrate intake a little bit closer than maybe another individual. But fruits are all very healthy for us and something we all need in our diet and should have. So the main thing is just to practice moderation, have a variety of fruits in our diet, just like we would with most other food items.
Oh, that's great to hear. Everything in moderation. And my last question for you, Dr. Whalen, is in regards to serving size. People don't truly know or have an idea of what the exact serving size that they should have for a common item. Can you describe that to them, or give us an example?
Yeah, so you don't need to measure everything out. It could just be as easy as using a tool like your hand to figure some serving sizes out. So
Not my
if you
hand.
use like your well, and so it's relative to kind of the person as well. So that
Yeah.
it goes with like your size and your frame, right? So like the size of your fist, which is also similar to like the size of a baseball,
Got it.
that is about 1 cup of something. So it could be like one serving, 1 cup of fruit or vegetables or cereal. That's what you could think of as just the fist. If you had a cupped hand, so kind of like you're cupping your hand like that, it's about 1/2 cup. So like maybe if you had a 1/2 cup of nuts, or maybe some grains. You can also use the palm of your hand, or which is about the size of a deck of cards as well. That could be equivalent to your protein serving. So if you wanted a piece of chicken or fish, about the palm of your hand would be a serving size, which is about 3 to 4 ounces. And something like a tablespoon could be like your thumb. So if you were looking to have something like peanut butter or another condiment, about the size of your thumb would be the serving. And if you want to go a little bit smaller for a teaspoon, so something like oils, if you're cooking, it would just be the tip of your finger. That would be about the size of a teaspoon. So just using your hand could be a simple and quick, easy way to try and get some of the accurate serving sizes of some food items.
That's awesome. Thank you very much, Dr. Whelan. And before we close and finish on this call, I'd like to go through the panel one by one so you can give a final comment to everybody listening on this virtual call, starting with you, Dr. Mody.
Thank you for having me. I think my one takeaway point would be to, emphasize regular follow-up with your primary care provider to ensure you are up to date with preventive health screenings, and to establish that relationship. That's all. Thank you.
Thank you, Dr. Mody. Dr. Franzoni?
There's a lot more to talk about. Hopefully we'll get together again. But just on the heels of the BPH talk, if men are experiencing urinary tract symptoms that are, interfering with their lives or are associated with other symptoms, pain or difficulty urinating, I urge you to bring it up with your doctor. And so, because sometimes it may be, just benign enlargement of the prostate, but God forbid it could be other things, diabetes, bladder cancer. So don't ignore those symptoms.
Thank you very much, Dr. Franzoni. Dr. Visveswaran?
My 2 points is don't ignore the symptoms. When you feel wrong about something, you feel that anxiety, or you just feel chest pain or shortness of breath, don't put it aside. Don't wait till tomorrow. Get the help you need today. The second point is the number one, and if there's anything that you could do to reverse or prevent the occurrence of heart disease or atherosclerotic disease, it's managing your blood pressure. Managing that blood pressure as aggressively as possible is going to be, worth its weight in gold in preventing the occurrence of the disease.
Dr. Feldman?
My takeaway points for today are rotator cuff problems are the most common cause of shoulder pain in patients older than 45. Use ice for acute injuries, heat for muscle spasms. If you're a weekend warrior, ease into your activity, condition yourself, don't go 0 to 100.
Perfect. And last but not least, Dr. Whelan.
Yeah, so the 2 factors that you can directly control in your health are nutrition and diet. So I would say focus on a nutritious diet, plant-based food items, add more color to your plate, fruits, vegetables, whole grains, limit the processed food items, and just get moving every day.
Thank you very much. And on behalf of myself and RWJBarnabas Health, we greatly appreciate all of you taking the time tonight. Stay safe, stay healthy, have a great summer, get your physical activity, and look forward to having you with one of these soon. Thank you very much.
Thank you.
Thanks, Dave.